Dr. Hilal. Today I'm going to, in this live streaming, make a fast, rapid review for hepatitis, viral hepatitis. Viral hepatitis means liver disease due to viral infection, viral hepatitis. We have five, A, B, C, D, E. We have five types of viruses that can cause viral hepatitis, A, B, C, D, E. But practically, the most important are two of these five. They are five, but the important ones are two: hepatitis B, hepatitis C. Others, like hepatitis A, it's just a disease like influenza. E, it is not very practically, is not very important. D is linked to hepatitis B. So usually when we discuss or talk, we talk about hepatitis B and hepatitis C. Both of them have common features, like they are transmitted by blood and sexual intercourse. Both of them are viral, but actually they are very different categories of viruses. They share only the name, viral hepatitis. But viral hepatitis B is caused by virus B, and virus hepatitis C is caused by virus C. Laboratory tests for these two viruses are as following. Antibody test, which is the most common type of test for both hepatitis B and C. Okay. Also, there is test called antigen antibody test, and also we have PCR or RNA test. Let us start by laboratory tests which based on antibodies. For hepatitis B, we have the common tests we use: hepatitis S antigen. This is the landmark of diagnosing hepatitis B. Hepatitis S antigen. This is surface antigen. Hepatitis B S antigen. It is written HBS antigen, ANAG. After exposure to infection, if the person is really infected, this will be can be detected. This antigen can be detected during the first month after exposure. So the window period of hepatitis S antigen is around 30 days, but of course it can be detected maybe after 2 weeks of exposure. Okay, and the rule here: if you start testing for hepatitis B, you have to do two tests. Start with hepatitis S antigen. If it's positive, proceed to other tests. If it's negative, close the topic. You are not infected with the virus hepatitis B. So hepatitis surface antigen can be detected and indicate infection during the first months of exposure. If hepatitis S antigen is negative, as I said, this means you are not infected, so you can proceed for another testing to see if you are immune or not. We can talk about this later. Let us continue the other hepatitis B tests. We have also hepatitis B C antibody. C indicate core. This test even appears before or can be detected even before hepatitis S antigen. Of course, there is two types, IgG and IgM. IgM, if positive, HBC core antibody type IgM. If positive, what does indicate? What does indicate? It indicates recent infection. It indicates recent infection. And this is usually detected in acute cases. The other type of antibody, core antibody, is IgG. IgG appears after a long time of exposure. So being positive indicates an old disease all the time. So it is positive in cases which are chronic hepatitis B. So core antibody, if we need to differentiate between acute or chronic, and it is important because if acute, this means maybe you will recover as from the disease completely and the virus will be eliminated completely from your body, and this happens in almost about 80-85% of patients. But if you still, after exposure 6 months and you didn't recover completely, this means you are now in the chronic phase. In the chronic phase, when we do the core antibody IgG type, it will be positive. IgM, it will show negative. This is how we diagnose hepatitis B virus. Hepatitis S antigen is positive. Okay. Hepatitis core antibody IgM positive. This means these two together means acute hepatitis. You have hope to recover completely from this infection and go to your normal health. The other scenario, when we do testing, hepatitis S antigen positive, hepatitis B core antibody IgM negative, while IgG positive, it indicates you are already in the chronic phase of hepatitis B, which you need more laboratory tests and other investigations. Maybe we can talk about this in another video. The remaining is for hepatitis B is the PCR test, which is RNA test that detects the genetic material of the virus. It can be detected almost in all patients after the window period is 1 to 3 weeks, but practically it is detected in most of the infected persons after 7, 8, 10 days. Hepatitis, this is regarding hepatitis B. Hepatitis B is transmitted mainly by sexual intercourse, but it can be transmitted by blood or blood contaminated subjects like sharp needles, sharp objects, and also from the infected mother to her baby during delivery and during breastfeeding. We shift to hepatitis C, the other one. Hepatitis C is in its transmission is different from hepatitis B, being more blood transmitted than hepatitis B. Hepatitis B more by sexual activities, hepatitis B more by contaminated blood or blood components that has been infected by the virus. Both of them are transmitted by sexual and blood. Hepatitis B more by sexual, hepatitis C more by blood. Both of them are not transmitted by any way through the oral route. Okay, through food, contact, hugging, kissing, shaking hands, living together, eating together, sharing towels, sharing personal items, never. Okay, only sexual intercourse and the blood, contaminated blood. Okay, this is fast summary about the hepatitis, viral hepatitis, about their diagnostic tests, about how they are transmitted, and now I come to the end of this fast live streaming. Hope it was useful for you. So if anyone see this video. It will be available after I finish. It will be available in the channel. So if anyone has a comment, has a question, don't hesitate to put it under this video, and I will sure I'll be glad to reply you immediately. Thank you for watching, and this is sponsored by Helal Medical, Manila, Philippines. Thank you. See you again.